It's 7:27, and a really heartbreaking story to bring you now about access to GP appointments. Newsnight has found that NHS officials ruled a man who died after his ear infection was not picked up in GP telephone consultations. Should have been seen face to face. David Nash had 4 remote consultations over 3 weeks during COVID restrictions, but was never offered an in-person appointment. His infection led to a fatal abscess on his brainstem. Andrew and Anne are David's parents. Morning, both. First of all,
good morning.
Just morning. Incredibly sorry for your loss. Tell us a bit about David.
He was a wonderful man, 6'7" tall. So when he walked into the room, you knew he arrived. He had an amazing sense of humour and had so many friends. He was a drummer in a band for a period. He just loved life.
And what happened to him? Because he was basically feeling okay when he first spoke to a GP, wasn't he?
He was. His symptoms sort of developed over a 19-day period, during which he had 4 remote consultations with his GP practice. What was clear was there was an escalation in his symptoms. So it first started off with an inflamed lymph node in his neck, lymphadenopathy. That developed into an ear infection. And then in the week before he became critically ill, he was passing blood in his urine. And although the doctor in the remote consultation acknowledges it's very unusual, you don't have any symptoms which associate with a urinary tract infection, he was remotely diagnosed with a urinary tract infection and prescribed medication that would only deal with that. And then on the last remote consultation, David had now been suffering with a fever for a period of 10 days. And despite testing negative for COVID, that was dismissed as a possible false negative. So fever for 10 days. He had debilitating neck pain that had left him bedridden. He had nausea, nocturnal headaches, and sounded extremely unwell. And of course, later that same day that he had the remote consultation, his condition deteriorated until he was admitted as an emergency case to A&E, by which time he was critically ill.
During that 19 days, how worried were you, and how worried was he?
We, as his parents, he kept in close touch, but we just on phone calls, literally. And he was concerned, but he was very reassured by the first GP, who gave him, all the reasons to ring back if he worsened, and therefore he trusted them totally. And I think he was reassured. I think as the weeks went on, he didn't convey to us all the symptoms at all. So we've only found out, retrospectively what actually happened.
So his reassurance was sort of passed on to us. As I say, it's very upsetting to listen to the audio. And when David's telling us, I've got a urinary tract infection, and then you listen to the audio and the doctor says, well, it's very unusual. You don't have any symptoms that associate with a urinary tract infection.
Yeah.
Therefore, passing blood in your urine then becomes a very worrying symptom if it's not associated with that.
And because he was young, he obviously was fit in other ways, which is, was obviously went against David in certain aspects, because he became very unwell, the last week.
Yeah.
But still didn't tell us as his parents. So we obviously left with a terrible guilt and feel we could have done more, but we had no idea.
No.
And like David, we trusted what he'd been told.
Well, you would, wouldn't you? No reason not to, I suppose. What message do you want to get across, Andrew, about what happened?
The message I'd like to get across is there is a place for remote consultations, and many patients, including myself, have found them very useful in the past. However, getting that balance right is very important, and the appropriate application of a remote consultation is when you're dealing with an issue that you know what is causing it, and the treatment is fairly clear. What is apparent in David's case is that as his symptoms are escalated, for example, a young man who's now suffered with a fever for 10 days, not to see him in order to get a definitive management plan in place. And effectively, just to sort of try and almost guess what the problem is without seeing the patient is completely inappropriate. And that's certainly the findings of NHS England when they investigated David's case. They said he should have been seen.
He saw he consulted with 4 separate practitioners. There appeared to be no methodology in the practice of linking or raising any alarm in their heads. And also, to prescribe, as Andrew just said, to prescribe to him medication, particularly on the 3rd and 4th consultation, when they had absolutely no idea what was wrong with him.
Yeah, they were purely treating a symptom without actually determining the underlying cause. And as Anne said, there's no continuity of care. Every phone call, every time he had a remote consultation, it was like the first time he'd rung. And none of the clinicians seemed to make a connection between his sort of regular contact with them, other than on the last day when that clinician was aware he was meant to be coming in to have bloods tested that day to investigate his lymphadenopathy. She was aware that he was being treated for a urinary tract infection. And here was the same young man now ringing up again, complaining of a whole raft of new symptoms. And the disappointing thing is, on his previous consultation when he was diagnosed with the urinary tract infection, the doctor said, if you feel unwell in any way, you must call back. Well, when he calls back, of course, he talks to a different clinician. So the safety netting he received at each consultation didn't seem to carry through to the next consultation. And on his last appointment, no safety netting was given. He was purely prescribed with a painkiller, and all that did was treat the symptom of his debilitating neck pain that had left him bedridden. And the clinician didn't say, look, if this happens, you must do this. So later in the day, he starts to vomit. So his nausea has now progressed onto vomiting. But of course, NHS 111 it's call handlers you're speaking to. It's not medical clinicians. So, without the appropriate safety netting, both Dave and his partner were completely unaware of the peril he found himself in.
Listen, thank you so much for speaking about this so calmly and eloquently, and I feel really awful for you. I'm sorry.
Thank you both, Andrew and Anne, parents of David Nash, who sadly died. A couple of statements to read you. An NHS England spokesman said the NHS has made it clear that every GP practice must offer face-to-face as well as telephone and online appointments, and that clinical judgment alongside patient preference must be considered. More than 19,000 additional staff have joined the primary care workforce since 2017, and the latest data shows GPs delivered over 26 million appointments in July. This is above pre-pandemic levels, and with most people seen in person. And then a statement from NHS England North East and Yorkshire said the NHS offers sincere condolences to David's family. We've investigated the family's complaint regarding their son's treatment with primary care and provided them with a response. You're listening to 5 Live. It is 7:35.